15 years after the devastating earthquake in Haiti, the country continues to struggle, particularly with ongoing gang violence, health, and humanitarian challenges. In 2024, the UN says over 5,600 people were killed due to violence alone. Joining me now to speak about this is Manon Hourdin, International Operations Director at Doctors of the World Canada. Thank you so much for joining us.
Thank you for having me.
How did the January 2010 earthquake impact Haiti's health system, and what's the current state of it?
When the earthquake happened, it completely collapsed the health system. First, because everyone was impacted, or a large portion of the population. And I'd like actually to pay my respect to everyone that has been affected directly or indirectly by that earthquake. So we had Médecins du Monde, we had our operation in Port-au-Prince, we had an office, we had staff. Some of them were killed, lots of them were affected. So the whole system, their needs arise and the system weren't able to face those needs. And we're actually seeing quite the same situation now. We have more than half of the health infrastructure in Port-au-Prince that are not functioning. Those that are functioning don't have enough staff, enough medicines, enough medical equipment to face the needs of the population that itself face more violence, violence based on gender. We're seeing also an increase, a massive increase of sexual violence. So the needs are rising, but there is less and less access for that population.
So what kind of work are you doing with the Doctors of the World Canada to help the situation currently?
So with Médecins du Monde, we're working with the person that have been displaced. There's a lot of people that actually had to leave their neighborhood, their home, and they're either staying in overcrowded space that used to be school, gymnasium, or they stay with families. But that creates also so much intimacy and a lack of hygiene that it increases the risk of any disease. But we're also seeing a lot of violence and sexual violence in those settings. So we go there to provide care, but also to provide mental health service. That's something that is really needed. We're seeing people that have faced so much trauma in such a few years that we need to provide healthcare. So those people will then be able to request or try to find some other needs that they have.
Thank you so much for joining us, Mano.
Thank you.